Hi, everybody. If you like my channel, please like and subscribe. There's a notifications bell down at the corner that will let you know as to when I'm going live. And today, with Coffee with Manda, I want to talk about a project that has been going on and I'm a consultant for. And that is the One Health research project, or the One Health Clinic. Hi, Megan. And I was really, yesterday, I was at an exhibit, and it was a really beautiful thing. It was done through everythingtome.org, which is ran by Jamina Garland and some other phenomenal people. And what they did is they talked to people about their interactions with their animals and homelessness, and what were the positives and what were the barriers to having an animal while facing displacement. And one of the things that we have found is that with the One Health Clinic, people experiencing vulnerability, homelessness, on so many levels. Hi, Ritra. On so many levels, will care for their animal before they will care for themselves. And so when we pair and we collaborate with not only just vet care, but nursing programs and medical residents and different, you know, um, specialties, we get better care and we get people healthier. And so it's been amazing. We've shown amazing results, and honestly, if please visit the Everything to Me project. And also, on today, I have done something a little different. Usually I just put my PayPal and the wish list underneath there, but today I wanted to really show people what the One Health Clinic is and give a way that they can help out there. And the One Health concept starts with humans, animals, plants, and the environment in which they reside. And we know that this is a health issue, a public health issue. Not only can infectious diseases, fungal infection, all sorts of things can be passed back and forth, and so our environment and the beings in it automatically or have an effect on us. And so then when we collaborate with different facets of healthcare, we can give people a better way of treatment, and we can also find out the impacts that having these kind of crises can have on our environment and what that does to the animals in our environment. And the level of care, there's so much that we can find out through a One Health project or a One Health approach. And I also, even though it isn't mentioned in the One Health approach, we are all very cognizant of trauma informed care, understanding that when a human being or animal, anything undergoes a trauma, there are physiological changes due to that trauma. And so what that means is physical. There are physical changes either on a cellular level or many different levels in response to that trauma. So within the One Health concept and the collaboration of different medical professionals and different sectors, we also have a trauma informed care model. And what I would like to also, hi Sheila, I love you. What I would also like to say as well is here in King County at some of the high schools, we are up to hi, always smile. It's nice seeing you on here. I haven't seen you in a minute. So we have had 6 ODs resulting in death due to pills that were marked as certain ones, I guess, as opiates, and they contain fentanyl. And so we've had several kids at the high school OD, and some died. So we are needing more than ever for harm reduction. We need fentanyl testing strips. Keep people alive until they're ready for treatment. And this is a problem. The fentanyl problem is a problem that affects everyone, every single person, just not only in the humanitarian aspect, but on a fiscally responsible level. We understand that these are public health issues and we have to respond as such. And one thing that we've noticed through harm reduction is that by handing out these fentanyl testing strips and telling people what it's for and letting them know, we give them a chance to start that conversation within that community. We give them a chance to talk about treatment options, or we give them the chance to understand that this could be deadly, that this could be deadly, that something they were about to take, they test and find out that it contains deadly amounts of fentanyl. We just saved a life. And I think that we can all get with that. And so, again, I'm going to put out a call and I put the Amazon wish list down for fentanyl testing strips. They are needed, please. We are working out how to get large amounts of Narcan at this time. And so it's all coming together. Another really exciting project is I'm going to meet tomorrow with the developer of the app called Strapped, which is spelled STRAPPD. Now, it says that it's only for youth, but it is not. It is for everybody. And as a service provider, I am begging you, download this app, enter in your service provider information and the services that you offer. The only way that we can get these things to be real time and helping one another is if service providers go in and update their stuff and have it on here. This is such an important thing. And when I talk to him tomorrow, I'm going to mention we should really patch in and get real-time counts every day of shelter beds available. People shouldn't have to wait on hold with 211 while it all gets figured out when they only have 60 minutes on their phone. That sort of thing is ridiculous. So to have an app that can work through Wi-Fi, or it also has a website, so if somebody's at the library, they can check it out. This opens mass options. So I'd really like to see people go and check it out. It's huge. It could be a really, really positive asset to our communities. And it also gives people a way to communicate with those service providers and also kind of give reviews. It doesn't allow for long reviews, just like a kudos up or down, but it gives a good idea. And so I'm just really, really excited about that. Just on a human level, I just dipped this in my coffee. So if any of you were feeling like lack of perfection today, just remember I online dipped my thing in my coffee. And I'm still going to drink it. So that's what's going on right now. It's been a really it's been just so exciting with some of the developments. Next week, I start some community engagement programs. And I also want to just say and give a huge thank you to those of you that reach out, support me, whether that be monetarily, sending things that I need, through donations, through uplifting messages, through being that person in my life I can talk to. Those things are just key in upholding a person. And I want to let you know that I do take in every investment that somebody puts into me, whether that be time, whether that be love, whatever that is. And I do use that to try to make a positive difference in this world. And so I just want the rest of you to know that if there's people like that, like me, know that there's tons, if I'm one person, there has to be others like me that are just waiting to be uplifted. And I saw this story about a woman, and I'm sure it went national. It's a viral story at this point, of the unhoused woman singing opera in the subway. And everybody was, oh my gosh, and shocked. And Woo! And now they're going to invest in her. Well, here's the thing. This isn't something that is just like, oh my gosh, look at that one person. There are amazing people out there. There are phenomenal people. I didn't just all of a sudden become kind because I got housed. It did house being housed allowed me to spread that kindness and really build upon what I have and be able to give more. But the thing is there are, we shouldn't be shocked when we see someone unhoused that's has this beautiful soul. You know, there are beautiful people in this world, okay? And it doesn't matter housed, unhoused. Your home does not your housing status does not determine the kind of person you are. Your clothing does not determine the kind of person you are. It's your heart and your soul that determines your behavior and your actions and how we have this wonderful ability to make mistakes in our lives and learn from them and be better human beings. The resilience just astounds me. And honestly, sometimes I'm surprised by myself. And I'm just like, wow, didn't think I could get through that. And bam, here I am. There's hope. So, oh, hello. Hello from Seattle. um, I want everyone to know that be there for one another. When we uplift people, I think that there's no stopping what we can accomplish in a very beautiful, good way. And I think that it's important. And it's important to know that what our eyes tell us is not necessarily everything or the whole story or the truth. So that's what I have to say for today. I'm going to ask anybody if there are any questions, especially about One Health concept, because I'm like really fired up about that right now. Um, it's just shown so much promise and we've learned so much about it. Even now to the point where we have had a really huge uptick now in our shelters and everywhere accepting pets and service animals to make sure people come in and get the services that they need and that doesn't become a barrier for them. And that is huge. That is really, really important. Um, so any questions? Anything at this time? No? Okay. Well, I'm going to get off of here and I appreciate you guys coming to Coffee with Manda. And from time to time, I'm going to tell you about projects that I'm involved in, like One Health or harm reduction or any number of education or civic engagement or city hall. It's about to get beautiful and wonderful. And I see these they're growing pains for sure, but they're changes and there's good changes and we are making differences. And it's really exciting to see, you know. All right, guys. Sending all my love and hope, and I will talk to you all later. Bye.